Hi, everyone. I know we have several viewers on here already. My name is Dr. Derek Phillips, and we're just waiting on some of our presenters to get on the call tonight for this webinar. So just give us a few more minutes here, and we should be getting started shortly.
Hey.
Hello. Welcome, everyone.
Are we live yet or not?
Yes, we are.
Okay,
We are live.
great. Um,
So, yeah, welcome everyone. I see that we have several viewers here this evening. Welcome to this webinar presented by the Early Career Neuropsychologist Committee of the Society for Clinical Neuropsychology, Division 40. My name is Dr. Derek Phillips. I'm the professional officer of this committee. I also have Dr. Callie Dunn, who is the programming officer of this committee here tonight.
I'm here. I'm happy to be here.
And tonight we're happy to be presenting this webinar, advice on a neuropsychology private practice. We're really glad to have everyone here tonight. We have two wonderful presenters, Dr. Bruce Jasper and Dr. Laura Renteria. Welcome to both of you. I didn't prepare an introduction for either of them because they wanted to get right into the content of this webinar. They'll be talking about themselves as they go through the presentation. I'd like to encourage everyone that's viewing, if you would like to ask questions, please do so through the various social media, through our Facebook page, through our Google Plus page, through the listserv, and just have a great time. We will open it up for the questions at the end, so we'll kind of bank those towards the end. So I don't want you to think that we're not answering your questions. We will get to as many of them as we can. But without further ado, I'm going to hand it over to our two wonderful presenters tonight.
Go ahead, Dr. Renteria.
Well, thanks everyone for joining us. What we really intended to do with this talk is to try to put together some content for folks that are thinking about starting a private practice and are very early on in the process, giving you advice in terms of what you need to do and things that you need to consider. And certainly, even in our own experience, we feel like we needed to talk to a lot of people to really get the best advice on how to do this. I know when I first got started, I met with an accountant and talked to other people in private practice to get a better sense as to what to do. So please do not consider this professional advice. Please do make sure that you discuss business plans with your accountant or some other legal consultant to decide what is going to be best for you. But in terms of our background, which I feel is important for you to know so that you know where we're coming from, Bruce, why don't you give people a description of what your status is, I guess, at this point in terms of private practice?
Okay. I'm in a solo private practice. I'm in the state of Iowa, and I have no employees other than myself, and I'm enjoying it a lot. I think for me, the choice to be in private practice has been not just a big question at the very beginning when I decided to go into private practice, but it's more of an ongoing question. I still check out what job positions are out there on the list or on different advertisings, and in fact, I think it was just within the last year I interviewed for a paid salaried position, and they made an offer that I was blown away by. But as I thought through it, I decided that I really like private practice enough to just stay in it. So that's kind of where I am. I see both adults and children in my practice. I do both clinical and some legal independent evaluation type of work. I don't do any psychotherapy, just mostly just assessment.
And I live in Illinois, and I've been in private practice since 2007. And I work in two different group practices, and I started in private practice pretty much right out of postdoc. And my reason for going into a group practice was honestly due to anxiety in terms of really not knowing how to set up a practice, not wanting to do it alone, and so there was some comfort in other people going through the same thing as me. So one of the group practices that I'm in was actually a group of individuals that had finished postdoc at the same time, and we all started working together. I have, just so you know, a PC that files as an S-Corp, and we'll talk more about what that means, whereas Bruce has an LLC that files as an S-Corp. Kind of sounds like mumbo-jumbo, but it'll all make sense. So one of the things that you need to do right at the beginning is to get IDs. One of the first things you'll do after you'll finish your postdoc is to get something called an NPI number, which is a National Provider ID, and it's required by HIPAA for anyone submitting any kind of a paper claim or collecting cash from patients. For some reason, it looks like the slide there is empty, so it doesn't contain the content. I don't know why it's missing. but we did provide or a website for where you need to do that, where you need to sign up for an NPI number. And you can have an individual NPI number as well as an NPI number for a group if you're working with a group. The other thing that you need to do is you need to obtain a tax ID. It's called an EIN, or an employer identification number, and it's used to identify you as a business entity. And you can either do this on your own by going to irs.gov, or you can hire someone like an accountant, or you can go to an online service like BizFilings or LegalZoom, and you can pay a fee to have them file the paperwork for you. And it is very important that you think about incorporating your practice, because creating a business entity will create a separation between your personal and your professional affairs. And this is really important because if someone decides to sue you, the business can shield your personal assets from any kind of business liability. So let's say you have a business and for some reason you can't pay your bills, or your business is being sued. Your personal assets, if you've got a business, won't be on the hook. So your car, your house, your personal bank account will be safe. So that's why it's really important that you create the separation between the two. The other advantage to creating a business is that you can deduct any kind of pre-tax expenses. So things like travel, computers, phone bills, gifts, mileage for your car if you have to travel to a place of business to see patients. All those things you can write off. And in fact, at this point, I've been in business since 2007. I've actually paid off my car. I have like a $35,000 car, and it's been completely paid off because I track my mileage. So there is some advantage to that, obviously. So when I first got into this, I met with an accountant who really gave me two choices. It was an accountant who specialized in working with businesses. And he said, I would advise you either start a professional corporation, a PC, or you create an LLC, a limited liability company. And I'll talk about kind of the main differences between those two and why I decided to go with PC. But a professional corporation is basically a company that has a very strict structure in terms of how ownership of the company is set up, so that you have shareholders who own the company, and they elect the board of directors. I'm the sole owner of a professional corporation, so I own all 100% of the shares of my company. Typically, if it was a different kind of company, or if there were more owners, you would have a director who oversees larger issues within the company, and they also elect officers, and then the officers deal with kind of day-to-day things of business. This kind of business structure, I think, really does a good job of separating your personal life and your company. And so if you have investors, if you're trying to go to a bank and ask them for money, I often feel like they're just more comfortable with this type of structure, business structure. The other thing that's different about a professional corporation or a PC is that you have stock, and you can issue that to, or use it to attract investors. Because you own stock, you also have to hold annual meetings. You have to keep records of the meetings. A corporation is a little bit different in that if you choose to kind of dissolve a corporation, it takes a different path than if you had an LLC, where the company will continue to exist regardless of who the owners are, because it depends on who the shareholders are. One of the key advantages of a PC is the tax benefits, and it goes really back to how you end up filing your taxes. But with the PC, most people end up filing their taxes as an S-Corp, and I'll talk about what that means later. But what it means in terms of taxes is that as a PC, you pay yourself a reasonable salary. You can decide whatever that is with your accountant. And then any money that's left over that was earned by your company that year is given to you as a dividend or a profit. And that actually is taxed at a lower rate than income. And so you end up essentially getting to keep more of your money if you end up filing your taxes this particular way. Now, with limited liability companies, there's no limit in terms of how many owners you can have. With a PC, they cap it as at 100. Obviously, for me, I'm just one. With an LLC, you can choose to have members of a company manage kind of day-to-day things, or you can hire someone that's not within your company to oversee day-to-day activities. Typically, any profits or losses are assessed through the owners through their personal income tax return. No annual meeting is required. They're not issuing any stock. And with an LLC, the company can just dissolve itself if a member of the company just withdraws or decides to sell their interest in that particular part of the business. Single-member LLCs are required to pay self-employment tax on income generated within the LLC, and the owners of the LLC have to operate the LLC separately from their personal affairs, which would make sense. You can, and this I didn't know, this I learned actually from talking to Bruce, is that you can elect with an LLC to be taxed as an S Corp. This is where it kind of gets a little bit complicated, because in terms of how you want your business to be taxed, you have a choice when incorporating if you want to file as the C Corp or an S Corp. And I've talked about the differences between those two. Really, the C Corps are geared toward very large companies. They're subject to double taxation. I've never seen anyone with a private practice file as a C Corp. It just makes more sense to do it as an S Corp. I'm kind of going to go through quickly through these slides just because we have a lot to talk about, and this is not kind of the more important stuff. I think if you talk to any accountant, they're going to recommend an S Corp. It just makes more sense if you're in private practice by yourself or in a group. So I'll skip through those slides. And we come to the slide where I talk about liability in a group practice. Going into this, not really knowing anything about private practice, I didn't know that some types of companies or some types of corporations are more advantageous than others. I think sometimes people misunderstand that just because it's called a limited liability company, that for some reason that creates or causes there to be some protection against liability within the group. But that's not true. If someone within your LLC is negligent, like let's say a manager in your LLC is negligent, then both you and the manager and the company will both share that liability. Whereas it's a little bit different if you have a PC and you're the sole person in that PC. The way that my private practice group is set up is that we all have our own PCs. So we all basically run our own company. And so if one of my colleagues does something, that protects me against any negligence on that person's part. I hope that makes sense. So that's one advantage to having a PC. But of course, nothing but insurance, honestly, at the end of the day, is going to protect you against any kind of negligence or liability, and that's something that Bruce will talk about later. One case that I'm not going to go into too much detail about is a case from 2012 that goes, well, if you read through the case there, it goes through why LLCs really provide any kind of protection. They used to, due to the way that the legislator had kind of written up or the language the legislature had used. But basically this case is this group, Swanson Group, had purchased Sunstud's lumber mill in Oregon, and they had reorganized that business as an LLC. So Swanson was kind of the sole member of this sole owner, of this LLC, and it owned several other LLCs as well. Swanson would provide all of its LLCs with kind of a template safety manual for them to use, but it never checked in on any of them to make sure that they were using the appropriate safety policies to protect all of their employees. Well, what happened was Antonio Cortez was working for Sunstud's Lumber, and he was walking across company premises. It was poorly lit, and he was hit by a forklift and had pretty badly injured. He ended up suing or received work comp benefits, and then opted then to sue Swanson Group, alleging that they were pretty negligent in providing him with a safe workplace. And on the next slide, you can see that Swanson actually moved for summary judgment to dismiss Cortez's claim, saying that it was actually immune from any kind of liability as an LLC, to be held liable for any kind of obligation against anything negligent that had happened with him. And there was also this clause called the Work Comp Act's exclusive remedy, which had indicated that if a company had work comp insurance and the injured workers their only remedy was against the employer was through a work comp claim, and the employee later could not bring a suit against the employer or its officers and directors for that very same injury. But after a court of appeals and the Supreme Court and all this, which again I won't go into too many details about it, the court decided that basically if you're within an LLC and someone does something, whether it's an act of omission or they're negligent, they're responsible. Which again goes back to it is very important that you have some kind of a liability insurance. All right. So how much will incorporation cost you? what I found is the price depends on the state you live in. That makes a really big difference, as well as who's completing the paperwork, whether it's you, an attorney, an accountant, or an online service. When I signed up to do this, I used an online service. I used bizfilings.com. And what I did was, on the next 2 slides, I provide quotes for how much it costs to set up an LLC in Illinois versus Iowa, as well as how much it costs to set up a PC in Illinois versus Iowa. One of the things that I kept hearing when I initially was filing for incorporation was that it was much cheaper to file for an LLC. But what I found is it actually depends on the states, because some states charge a crazy amount of out-of-state fees to be able to form as an LLC. So with biz filings, it's kind of nice because they offer you different packages, like a very basic package, kind of a medium package, and then like their best package, which offers you some nice stuff. Like I filed as a PC and I got like a corporate seal, which I've actually had to use a couple times. Let's see if I can hold it up. Here we go, like a corporate seal with the name of your business. And then they provide you this really nice binder, which has stuff like minutes and stock certificates, like things like a stock certificate, should I have any investors at any point, which is kind of nice to have this stuff because I don't know where otherwise I would come up with some of these things. There's also like bylaws for my company, minutes, transfer ledger, all really nice things to have. I haven't really had a chance to use them or needed them, but it's nice to have in case it ever comes up. But as you can see there, in terms of the breakdown, you get charged for various things like the corporate kit, which I just showed you, which comes with that company seal. You have to obtain a federal tax ID. There's like a formation fee for both an LLC and a PC. You get a DVD that they send you on incorporation. You get a business license specific to your state. You get a registered agent for a year. That's something that I didn't know about until I started in private practice, that in some states they require you to have a registered agent. It's basically a person or company that will basically handle your mail. So in Illinois, I have to pay someone to serve as my registered agent. I can't serve as my own. So they'll provide it free for a year, but after that it's $149 a year. Basically, all they do is they receive my state mail, like any tax documents, legal documents, and they send them to me. That's it. They basically serve as like another stop along the way. I know I had talked to Bruce about it, and in Iowa, he does not have to pay anyone to serve as his registered agent. He serves as his own, which is really nice, because otherwise you're just kind of paying $149 for like a mail forward service. So other things you have to pay for are certified copies of incorporation documents, and those are required to open up bank accounts and get credit cards in the name of your business, which again is really important to separate or create 2 different entities, a professional entity and then a business entity. And then of course they charge for shipping and handling and expedited fees, but you can see that in Illinois, for an LLC package, you're paying $984, whereas in Iowa it's $404. For an S-Corp package or a PC, you're paying $689 in Illinois and $434 in Iowa. And again, this is for that really fancy package where you get this nice stamp and where you get this really nice binder. They have cheaper options, but I elected to kind of go the pricey route since I didn't know if I would ever need these forms or not. All right. In terms of other things to consider, certainly in thinking about private practice, you want to think about office space. That can be a really big expense. You want to figure out whether you want to practice in multiple sites, whether you want to rent your own office, whether you want to sublease from an established private practice. I put in a script there that I thought might be helpful for individuals. If you're interested in maybe talking to other clinicians to see if you can rent office space from them. When my group got started, we actually rented office space from a neurology clinic and a psychiatry clinic. And it was great because it was a built-in referral source. They would send us patients and they kept us busy, and we got a chance to grow our practice and get other referral sources that were in the area. All right. And Bruce, honestly, feel free to jump in on any of these if you want.
Great. I will add one thing for me personally. When I was trying to figure out office space, my children's pediatrician said, "Bruce, we're tired of sending referrals to another city. When are you going to start seeing children in the community? And I was at that time just doing inpatient adult work and rehab. And that kind of triggered my thought of, there is a market since there are no pediatric neuropsychologists in my town. And so then I spoke to that pediatrician, and she said, let me talk to our office manager and building manager, and they hooked me up with a wonderful deal on an office. And so you may just find a group that, like you did, Laura, built-in referral source and maybe even a good deal on office space.
Yeah. Let's see here. Other things to consider are just office supplies, like, buying furniture. How much furniture will you need to buy? Desks, chairs, lamps, office equipment like printers or computer, filing cabinets, pencil sharpener. Any kitchen equipment like small refrigerator, microwave, utensils, or coffee maker if that's something you want to provide. General supplies like pencils and pens, clipboards, staplers, paper clips, paper, purchasing a phone or a voicemail system. What I do as part of my business is I actually use my cell phone, which is password protected, for my business, and so my business pays my cell phone bill. You will have to fax reports, and so will you use a fax machine for that or an online fax service? And if you do use a online fax service, you want to make sure that it's HIPAA compliant. There are some that are and some that aren't. We'll talk a little bit more about business agreements later because that's required by HIPAA. The other thing you might want to consider is purchasing a scanner if you decide you want to go paperless. And let me tell you, as someone who used to have 30 banker boxes full of paper in my basement, that I just went paperless in December, and it has been wonderful. I would highly recommend going paperless from the start. In terms of forms, things to do are, to develop a logo, you're going to want to buy business cards. The price for that can really vary depending on what vendor you use. I've used Vistaprint in the past, and they're pretty reasonable. They also sell letterhead. You also want to create various clinic forms, and Bruce provided me with this really awesome link that I didn't know of before. APA Practice Central apparently has a lot of templates you can use on their website. But you want to think about things like consent forms, a billing consent form, because you need to get permission to send the bill to the insurance company, release forms to release the report, a HIPAA form, and history questionnaires if that's something that you use as part of your clinic. With regard to marketing, you want to make sure you get a professional email address. You want to start a website. There are some sites that will host your website for like $5 a month. You want to set up Google ads so that when people search for you, they'll be able to find you online. You also want to make sure you create a website that will actually increase your visibility on Google when people search for a neuropsychologist in your area. You want to create an announcement possibly that you're opening a practice and mail that out to individuals that might be interested. Maybe create a brochure. I know with one of the group practices I'm in, we actually have a brochure that we mail out to referral sources on a pretty regular basis. The other thing that I do in trying to network is that whenever I see a patient and I'm asking them who they want me to send the report to, I will send with my report some brochures so that the new potential referral source has not only a sample report of mine, but now also has brochures if that person, he or she, decides they want to send more clients my way. Networking is really important. Marketing yourself is really important. Things that I've done is I've introduced myself to other professionals and met them over lunch to talk about my evaluations and how I might be of help. I've also mailed out brochures, business cards. I've given free lectures to try to introduce myself to people that otherwise would not know me and know that I'm available for testing. The other thing that's been helpful has been to obtain hospital privileges. You get listed on the website for that particular clinic, and if you're, if you have if you're paneled with a certain insurance, sometimes I've received cold calls just from that. Bruce, did you have any other tips you wanted to add with regard to marketing?
Your community might have, sometimes hospitals will join together to create a medical provider directory, and you can seek out those groups and get on those, get into those directories. Sometimes there's even, in our town, they have a courier system that the hospitals pay for transition of records. So transportation of records, and anyway, I can tell you more about that if you want to email me on that if needed. But the other thought, I just scheduled a lunch with an owner of a work comp case management company, and invited her to invite her colleagues, and so you just network, and it does, for some people that takes them quite out of their comfort zone, and so but I enjoy it, and so it's fun to go out, have your business pay for the lunch, and you just make sure that the cost of the lunch is, going to be covered by one of those referrals, and then you're good to go.
Yeah, that's a good point. Like, for me, I feel like in Illinois, I provide like a real niche service. Like, I'm one of a handful of Spanish-speaking neuropsychologists, and so for that reason, like, I've had other opportunities, or I've had some opportunities that I think other people haven't. Like, for example, I signed a contract recently to provide evaluations for the Illinois Department of Rehab Services. I also have a contract with DCFS, so I evaluate people for them as well. And then I was working, this neurologist kept referring me cases and really liked my reports, so then I got panel to do like impaired physician evaluations, and then someone else saw a Spanish-speaking report and I got panel to do work comp cases, and so sometimes some of these things just come up. So people see your report, or they see that you provide a real niche service, and you'll get referrals that way. All right, so it's 7:30. I know we still have a lot to talk about. Bruce, you're up with setting fees.
Okay, so as far as fee setting goes, that can be a difficulty, just knowing, well, where do you set your fee? What is it? How do you do that? And my main point is just make sure to charge what your services are worth. And if the most recent salary survey, you can see from the data here, it's really neuropsychologists charge a very wide range of fees. $90 to $510. That's a big range for clinical fees, and forensic fees are not much different. So how to set your fees? You look at the median. Is your training at the median? Is your market saturated? Are there enough referrals? I think in most places there are plenty of referrals for as many neuropsychologists who care to live there. I don't know if I'm just delusional, or if that's the case also in Chicago area for you, Laura, or not.
It seems like there's like a steady, at least for me, I feel like there's a steady number of referrals that come through every month. One of
my trainers, Aaron Bigler, I remember in graduate school, he told me, if you just get close to 2 or 3 general practitioners, they can give you enough work to keep you busy. And so if you look at the physician directories, there are way more than 3 physicians per neuropsychologist in pretty much every community. So yeah, I'd be interested to hear if you could find any that have a different ratio. So with that fee range, how do you set your fees? The next slide shows, I just point out, assess what your work is worth. Are you well educated, well trained? Do you have good skills? Do you keep them updated? And how's your work ethic and work responsibility, professional responsibility? And if those are good, and if those are at the median, charge at the median unless your market is saturated. But also you can be flexible. I know I sometimes will charge less to begin a referral source. If it's a fee for service or retainer-based kind of referral. So the next slide here, it's in order to get paid the maximum amount possible when you're doing a clinical referral that involves insurance, you need to make sure that your billed amount exceeds what they're willing to pay, what the allowable is. So if you're the neuropsychologist that charges $90 an hour, but the insurance company you're charging is contracted and that they will pay $225 an hour, then they're not going to pay more than you ask for, and so you will get paid $90 an hour. So in an 8-hour evaluation, $720. However, if you bill at or above the amount that's allowable, and the allowable is $225, you're going to make $1,000 more. So, so I think that's really important as you contract with insurance companies. Figure out how much is the allowable for that particular insurance company, Medicare or Medicaid, in your area and your specific contract. So, as far as contracting with insurance companies, I kind of went the easy route. The hard route is to do it, and it may not be that hard, you know, but for me it seemed like the easy route. Instead of doing it myself one by one, insurance company by insurance company, and reading through each contract in great detail, and then negotiating those contracts if that can be done, I went with another option where I was fortunate to find what's called a physician hospital organization in my area, which is a group of physicians. A lot of times they're it's a associated company with a hospital that is a location where physicians and other medical providers such as neuropsychologists group together, and the organization itself negotiates contracts. And I know my billing company also offered to help do the contracting, but I went with this physician hospital organization, and so I paid a one-time initial application fee of about $1,000, and they went ahead with a single application. They got me on all insurance panels that were most of the insurance panels that were available, and then every several years, your contract comes up for renewal, and they change little bits in that contract, and I didn't feel like I'm in a great position to read through that. I didn't want to pay a consulting attorney to read through those contracts for me, but the physician hospital organization that I found has an attorney, reads through all the contracts, negotiates rates, and so those rates go up, and those rates go up over time, and so kind of took some headache out. There is a yearly fee of I think it's about $300. I should know that, and but that keeps those contracts renewed and going. Let's see, next slide.
And I guess
yes, please.
When I was getting on insurance panels, I actually did it all myself, and it is a pain, especially if you're defining benefits if you are working for a different company. But it was doable. We don't have anything like PHOs in Illinois that I know of. But what we do now is we actually use a company, which I'll talk about later, called HMS Midwest. They handle all our billing and insurance verifications, and they're wonderful. But the other thing that they do is when people join our group, they actually take care of getting them on insurance panels, which is really nice.
Great. So there may be something like that that could save you a lot of time in the startup.
Yeah.
Excellent.
It's worth it.
So using a billing company, this is a complicated. It can be complicated. There are a lot of different choices out there, options, software, and they all cost money. Now, some of them don't cost much startup money, and my particular billing company, the contract involves specific terms as far as the percent of the money that that comes in for the cases that they bill. My billing company, I negotiated a percent that I pay them as a fee for billing. They handle all of. I use an online system, and they handle all of the billing to the insurance company and the secondary insurance company, and billing to co-pays and other things. And generally that's between 6 and 15% of what comes in. As far as just some thoughts on when you work with a billing company, you'll want to have a business associate agreement which holds them responsible for HIPAA compliance, because you're going to be sending them protected health information. And if it leaks, you want them to be responsible, not you. Also, in the contract, it was important for me to make sure that my contract read that I can do fee-for-service billing on my own. So when an attorney calls me and wants to refer one of their clients, I just send an invoice straight to the attorney, a retainer invoice. They pay up front, and then I schedule and start reviewing records. And every penny that I get paid stays with me and does not, I don't have to lose a percentage to my billing company. Read the contract carefully. Mine was pretty simple, I thought, and I did not use a business attorney to review it, but you know, it's good practice to have your attorney read contracts. Let's see. Anything you want to add, Dr. Renteria?
I use a pretty similar setup to Bruce as well, where we have a company, in my case, HMS Midwest, and they actually service more than just the Midwest if anybody's looking for a billing service. They also handle our insurance verifications, which I think we're going to talk about later, and those are really important too. When I first got started with being in private practice, the insurance verifications can take a lot of time, but you're basically calling the insurance company to find out what the person's coverage is, and that's really critical because sometimes they may have a really huge deductible. You know, let's say their deductible is $5,000. Well, you want to know that and they want to know that, because if they owe that much, you want to make sure that you collect some of that at your first appointment with them. I remember early on having some cases where I wasn't aware that the deductible was that large because I hadn't done the insurance verification, and ended up on some cases getting paid nothing because the person was never able to afford to pay the deductible. All right.
Good. That is important. And those are all things you will build into your billing consent form, so that your patients and examinees, they know what they're agreeing to as far as fees, and they know that if they pay $1,000 of their deductible, and then it turns out that they meet their out-of-pocket maximum before you bill, they know that they're going to get their $1,000 deductible back while you get your payment through the insurance company. So those are things you'll build into your billing consent. Speak with others, network, speak with other early career neuropsychologists, and find, get copies of their billing consent forms, and use the other resources to develop yours. Let's see, other billing issues, non-compete clause. If you're currently, I entered private practice by leaving a salaried position as an employee in the hospital in the same community I set up my private practice. So I had my attorney look through my employee contract to make sure there were no non-compete clauses, and to help me draft my letter of resignation to the hospital. And so that can be very important. You don't want to lose all of your first year or two's income because of court fees and due to non-compete clauses. Hospital inpatient work, like Laura said, you'll need to get hospital privileges, and those take time if you want to do inpatient work. Billing consent forms, fee agreements, we touched base on those. Services not covered by insurance. So on my billing consent form, only certain activities can you bill to insurance, and so telephone consultations that are after the evaluation is completed, you might get a call 1, 2, 3 years later. I do pediatric evaluations. It's common to get a call from parents a couple of years later saying, "Oh, Dr. Jasper, he understood my child well, maybe I can talk to them about a situation that's arisen. I have on my consent form, billing consent form, just laid out what my fees are for telephone consultations, and we just touch base about that, and they agree to pay, and then I send them out an invoice. My billing company is not involved, and I get paid. Letters and copies and reports after the after you send out the copies of the report that you've agreed to do, perhaps free, you can charge for those. For example, Social Security Disability frequently is asking for reports, and you can charge a fee for that. And but you'll want to make sure that your fee is listed and consistent. Classroom observations aren't paid for by insurance that I'm aware of, so I let parents know how much I charge per hour to go into the classroom and observe their child if I think that might be helpful for their evaluation. Dealing with non-payment and using collection agencies. Speak with your billing company. It might be part of a service they provide. It may be in their contract, but you want to know about this so that you can have control. You don't want your billing company to go after someone without your consent. And fortunately, I've never had to use a billing or a collection agency, and but you want to know about your options there and whether or not you're going to choose to use them. Backdoor attorney referrals. These are where the way I use this term is when an attorney says you can get a neuropsychological evaluation without paying for it. Have your doctor order one for you. And so sometimes referrals that that instead of paying $61 an hour, they should be paying your full fee, maybe $225 or something else. You want to make sure that you can identify those. So ask on your intake forms whether or not they're involved in litigation, if there's been a car accident or other things, if they're involved with an attorney. And if they are, then you make decisions about your company's policy on whether or not you do clinical evaluations on those involved in and likely to go to litigation. Have that in your billing consent form. I have a clause in mine that says that if I get pulled into court, that I cannot bill insurance for that, and so I let them know up front that what my fees are and that I would be charging my full fees. Professional, next slide, professional liability insurance. Like Dr. Renteria said, limited liability and LLCs and PCs do lend protection of your personal assets, but they don't protect your company's assets from liability. Excuse me. And so you'll need professional liability insurance. And there are different types of policies. The information I have is from a company called The Trust. It's reportedly the largest provider of insurance to psychologists. And they offer, my understanding is they offer two different policies, claims made policies and occurrence policies. And the basic difference between these, besides that one is more expensive to begin with, is that the cheaper one, the claims made policy, it is only effective if you have a policy in place, a current policy. So you may pay for a year of coverage. Is my understanding is you may pay for a year of coverage, but if you stop paying for your policy and then somebody sues you associated with a patient who was your patient during your year of coverage, that coverage no longer covers you because you no longer have an active policy. So that's the cheaper policy. But in order to keep it in effect, you need to keep a policy active, or as you see at the end of that paragraph there, you will need to extend the reporting period. If you decide private practice isn't for you, or you decide to cancel your policy, you either need to pick up a new policy that will cover your prior claims made policy, or you need, if you're retiring, you need to pay for an extended reporting period called a tail, and usually that costs 175% of your most recent year premium. So it works. The occurrence policy doesn't have that downside. You pay for a year and you're covered for that year, regardless of whether or not you have an open policy or a tail. So as far as cost, just so you get an idea, usually, like the claims made policy, you'll see there that you see 1M/3M. That's 1 million per claim. So if somebody sues you and that your policy, you can pick different levels of policy coverage. I have the 1 million to 3 million, and so I display those here. That means that each case brought against you, your policy would cover up to $1 million, and up to 3 of those $1 million per year, is my understanding. The cost per year in the claims made policy, I mentioned it's lower than the occurrence policies. You can see there a progression. What happens is you start in the first year at a lower cost. In Iowa, California, it's 115 and 245. The second year, remember, the second year, what's happening is your current policy is also back covering. It's covering the prior year and the current year. And so the rate goes up, but what's nice is it caps off at about 7 years. And once you reach 7 years, your professional liability policy does not increase each year. So, so once you reach year 7, which I'm close to reaching, then you're maxed out, and you know you have a fixed cost each year for your liability insurance. The occurrence policy is month or year by year, and so you'll see in the very first year and every year after that in Iowa, if the rates stay the same, you're going to pay in Iowa almost $1,000. So, and in California, it's a little higher, and just a little higher, about double. So, there you have that. So next, let's talk a little bit about the cost of testing materials. It really depends what test you like to use. Some places, you're trained with people that use pretty much all free tests, and it really depends on what you want to use and the cost of acquiring those tests. Also, it's quite variable. We're really moving into this computer online testing age, and the companies that sell these tests they're becoming sophisticated. You know, their goal is to get I don't know what their goal is. Okay, I won't speak publicly on their goals, but all I know is it costs a lot sometimes to try to get these tests per use. For example, per use forms for the new brief 2 new edition, it's $6. You're going to pay $3 for the report form. You're going to pay another $3 to get it scored. You can't just buy a scoring form that you can with a scoring program with unlimited use. The former brief, the brief 1, you're paying $2.41 per administration, and can use your unlimited computer scoring program. Child battery, adult battery, you got to buy a lot of different tests. Condition-specific tests. I've just become interested in doing more pain evaluations, and you know, you have to get specialized instruments to assess pain symptoms. And I think I forked out about $60 to get an original article that helped me know how to administer it in the way that matches the data that I use to interpret it. So you're going to buy books, you're going to buy journal articles that will help you with test administration. Here's a table just showing just a sample. I looked at one of my prior evaluations of a patient with dementia and listed the instruments there. The cost to acquire those instruments is in the first column with the money signs. So $3,000 just to get the instrument, and then the per evaluation cost. So some of those are pretty big ones. If you administer the full WACE, you're paying $5. But there are some ways to minimize costs. So if you're just administering, if I'm just administering digit span, I may just write out the data on a legal pad, and then use that data that I write out to score it without using an entire $5 protocol form. So there are different techniques. I had a friend suggest, well, when you give this CVLT, you have to plug in all the words into the scoring program, and she sampled with, she gave it a try and learned that she could do her clinical administrations and just type the responses right into the scoring program of the CVLT while she administered it, and it saved both scoring time and the cost of the protocol. So there are some suggestions there. I bought, if you look at the next slide, just some advice. I found that I bought some tests that I thought, oh, this is going to be a great test, but I didn't research it enough. So I was a little bit impulsive, bought a couple tests, and I administered them a couple times, scored them, looked up the data, and went, oh, I wish I would not have purchased that test. So be careful what you buy. Do your homework. Make sure you buy tests that you need to answer the referral questions. If you're doing forensic evals or clinical evaluations, sometimes there are answers that you need to, questions you need to answer, such as performance validity, symptom validity. Those cost money, but you need them in order to do a valid assessment. Save money without breaking laws. I know someone, unfortunately, who I was just shocked they did so much copyright violation and just flat out copying copyrighted forms, and I just wondered, how can you do that? You need to make sure this is your business and you'll become liable for things like that, and you have to live with yourself too. So all right, on to you, Dr. Renteria.
All right, we don't have that much left, so or not that much time left, so I'll try to go quickly through this. In terms of hiring non-clinical staff, my husband's motto, and something that I've implemented at work too, is, do you really want to pay for something that you can do yourself? In some cases at one of my clinics, we do not have janitorial staff, so we do the cleaning, we do the vacuuming, the dusting, we clean the bathrooms, and it saves us money. We don't have to pay for someone to do that. Same for things like appointment booking. Do you want to pay for someone to help you with that, or do you want to do it yourself? Same with billing, if you prefer to do that on your own. For me, that's kind of the more difficult one, because sometimes people want to be put on payment plans and you have to keep up with sending them on a monthly basis, or if you need to send someone to collections, or sometimes the bill comes back because they didn't like the diagnosis code, and so for me that's something that's better handled by someone else. Insurance verification too, when we were first starting out, we didn't really have money to have someone do that for us, so we would do that ourselves, and it's something that I would do again, and I actually have done on occasion for some cases. You definitely want to hire at some point an accountant. As a business, you have to file taxes quarterly, which is something I didn't know before I got into this. It's kind of a pain, and so you want to make sure you have a good relationship with that person. And you know, you have to determine how much of a role you want your accountant to play. I know some people that have the accountant come in, and the accountant enters in all the details on QuickBooks, and they don't have anything to do with it, whereas in my case, I enter all the information and then send that along to the accountant, so it's more legwork on my part. Supervising trainees, this is something that we were asked to talk about, but actually neither Bruce or I actually supervise any trainees. But just in thinking about colleagues that do, you have to think about whether you have the time to properly train and supervise students. Do you have time to teach them all these tests if they haven't had the experience doing that yet? You have to keep in mind that the fee you charge will be different if a student does the testing. You have to think about how you're going to supervise how supervision will be structured, but then also, they have to earn a certain number of didactic hours. How will they earn that? I know some colleagues who have their students go to didactics offered by other larger practicum training sites, and so that's an option if that's available to you. In terms of record keeping, you want to think about making sure that you keep your testing files under lock and key, that they're away from public access. You want to make sure you determine how you're going to store those files, whether it's going to be paper versus electronic record keeping. You also want to determine how long the files need to be kept before being destroyed. It's 7 years. You have to, as a private practice, develop your own record-keeping policy. So you'll determine what you're going to keep at that point. What I decided to do is to keep just the DSS, or data summary sheet, and report for each person, and then after the 7 years, that's the only thing I keep, and everything else is destroyed. With financial records, you want to make sure that you purchase some kind of a bookkeeping software like QuickBooks or Simply Accounting to help you keep track of everything. You want to make sure you keep a copy of all receipts and invoices. I basically use my scanner to make a scan or scan any receipt that I have, and I plop it into a folder. At the end of the month, it gets put into QuickBooks. This is something you'll do pretty early on, but you want to make sure you open a business account for your company, a checking account, a credit card account. With regard to HIPAA, one of the kind of scary things about being in your own private practice is that it's your kind of sole responsibility to make sure that you're following the rules. And it's kind of scary these days, because these days, as I understand it, there's a finder fee, so that if a person, let's say a patient, goes into your office and they see that there's been some kind of a HIPAA violation, they can actually report you, and they get some of the money that HIPAA would get from you, or from the fine that they would get from you, which can be kind of scary. So there's some advantage to them reporting you, so you want to make sure that you're careful and following HIPAA rules as much as you can. So taking appropriate measures to get a business associate agreement from anyone that you work with. So, technicians, if you hire one, an email provider, your online fax services, if that's what you end up getting, your billing service, all of these individuals have to sign a business associate agreement. You need to keep that on file. There's a quick list there of things that you need to just make sure that you budget for as you're thinking about putting together your private practice. But I'm rushing to get to this final slide here, because it's all things I wish I would have known when I first got into this. The first definitely is that the work comes and goes. There are some times where I'm extremely busy. I'm working Saturdays and Sundays just to catch up. And there are some months that are just really slow and I don't have enough to do. And you really have to plan for that. You have to take advantage of the times where you're not that busy, learn to do fun stuff in that spare time, and just expect that that's part of the business, especially in the first year when you're just starting up. I remember it being really slow, not making a whole lot of money. It was kind of scary at the time. Certainly since then, things have significantly picked up, but expect that. The other thing is to expect a payment lag. Sometimes some insurance companies take a really long time to process your payment. There's one insurance company in particular that I've waited over a year sometimes for them to process a claim. There's one work comp case that I have since 2014 that I'm still waiting on payment for. So sometimes it can just take a really long time to get payment. Another thing is that private practice can be pretty isolating. I remember at the beginning, for me, it was quite a transition to be working. I had just worked in hospitals before. It was very lonely for me to just be home all the time. I do all my report writing at home. Sometimes there would be weeks where I wouldn't bump into any of my colleagues at the office. My only interaction was with patients, and it can be kind of hard to get used to at the beginning. For me, one of the things that was really important was actually getting a dog to keep me company when I was working home alone, because it got me out of the house for walks, 3 or 4 times a day. I felt like there was kind of something that I was interacting with. Otherwise, yeah, it can feel pretty lonely sometimes. Another thing is that it can be really important to stay on top of record keeping as you're going along. There's a lot of details to attend to. You want to make sure that all those records, whether it be receipts or invoices, that you're keeping track of all that, because it can be pretty easy to lose track of some of the details, and it comes back to you later in a negative way potentially. With that being said, there is a lot of just minutia to attend to, just a lot of details in your daily life. There are some days where I feel like all I'm doing, sometimes for hours at a time, is just kind of pushing paper around. Sometimes my husband gets home and I say, that's all I did. I didn't write reports, I didn't bill anything. I just kept kind of pushing paper around and just taking care of all these loose ends. Another thing that I learned is that marketing skills are very important. If you're shy, like Bruce said, you kind of just force yourself to talk to people. If you're not that kind of person, to get yourself out there, get yourself on panels and meet people to try to drum up some business. Also, because you're in private practice, you have to plan for not only the slow times, but also to save for retirement, to save for taxes, and for anything else that you need. Because sometimes it can be really crazy. You know, I mean, for me, I've had some months where I've made, you know, a difference between, like sometimes there's a difference of like $15,000 or $20,000, honestly, from month to month in terms of how much I'm making. Like there is so much variability sometimes, and you just have to plan for that. The other thing that I had a tough time with when I first started in private practice was boundaries. I wanted to do a good job. I wanted to finish reports as quickly as possible. Even now, I try to turn around reports within at least 3-4 days if I can. But that also meant that I lost a lot of my own personal time trying to do the best that I could, to always be available. And you really have to set limits in terms of, even though, you know, a lot of my private practice work is done at home, I set a limit. You know, 5 o'clock, 5:30 rolls around, and that's the end of my day. I'm not going to pick up the phone after that. I'm not going to respond into any email after that. And I think setting those boundaries is really important.
I agree fully. There are a lot of stressors that are involved in private practice that I didn't experience until I went into it, and a lot of that is financial, and then some of these psychological stressors of like Dr. Renteria mentioned. I know for me, I think I mentioned early on that the decision to be in private practice doesn't end when you enter private practice. You're constantly weighing the pros and cons, at least for me, each month, each 6 months. But I always come back to how nice it is to be your own boss and to be flexible, and you can set your priorities if you want. You know, if you and your spouse want to go on a vacation, you can choose to do that. My wife is a stay-at-home mom, and I get to have lunch with her every day. And my children, when they have events at school, I get to go to all those events because I get to control my schedule. And so there are a lot of advantages. And for me, I constantly weigh those pros and cons. And so far, it's always weighed in the direction of enjoying private practice and staying in it.
Yeah, that flexibility in your schedule for me is key. Like, it would be really hard for me, I think, to go back to like a 9-to-5 kind of job because I just enjoy that so much. I mean, I can do whatever I want. I can see however many cases I want per week. Like, there's no one demanding that I see however many. It's just whatever I want to see. So it's great.
Yeah. Thank you for this opportunity to visit.
Yes, thank you both so much for offering all of this really great information to all of our viewers. Man, there's just been so much information. There's one question that was presented that I thought maybe we could just answer really briefly. I know we're a little bit over time, but we have one question. It says, the 2015 Suite Salary Survey shows a trend of neuropsychologists moving away from private practice to institutional practice, presumably associated with increased risk due to reduced reimbursement rates. Is this also a problem in your group practices?
So I have seen a decline in reimbursement rates, but I think for that same reason, I've tried to avoid just seeing insurance cases. Like for me, it's important that I do contract work where the rates haven't gone down, or that I see work comp cases, or that I see legal cases, so that I am seeing a constant variety. And whereas let's say Medicare is only paying me $100 an hour. I have work comp cases that are willing to pay me $350 an hour. And I think for me that's important, because if those rates continue to decline, at least there's some variety in terms of my caseload that I don't see that drastic effect. But I think time will tell. I know that insurance companies seem to be moving in the direction of not only reimbursing less, but then also wanting us to see patients in less time. I don't know how long that will take for us to transition or to get to that point in time. Certainly it's a little scary, obviously, I think, for us, more so in private practice than those working in hospital settings. But we will see.
And my thought on that is that whether or not you're in private practice or salaried, you still have the pressure of reimbursement. So those in the hospital setting, when faced with a hospital administration looking closely at the data and saying, your reimbursements are going down, we're making less off of you. They don't quite say it like that, but you're going to feel the pressure to increase productivity because you have to pay for all the hospital staff and the CEO and everyone else. So you still have to earn your own keep, whether or not you're in private practice or not. Like Dr. Renteria said, I think the key in private practice is to diversify your referral sources. So it's like the stock market. If Apple goes under, you don't want all your stock in Apple. So similarly, I've had an insurance company that just stopped reimbursing neuropsych, and so I canceled my contract with that insurance company. And so it would be a shame if all of my referrals were from that insurance company only. I'd be out a job. So diversify and look outside of traditional reimbursement, and you can always survive in private practice if you want, I think. And if you want to work in a hospital setting, then you can do that as a private practitioner. You can contract, you can get privileges, you can go in, you can network, and you can work in a hospital setting without being managed by someone else.
All right, well, thank you both so much. I know we ran a little bit over time, but such great information tonight. I hope that all of our viewers tonight and in the future will enjoy everything that was offered tonight. And I want to thank Dr. Jasper, Dr. Renteria for presenting for us. Thank you, Dr. Dunn, for operating our PowerPoint tonight. And I hope everyone has a great night. And thank you all again for attending.
Thank you.
Thank you.
Thank you.